Hi, I'm Dr. McKee-Pownall of McKee-Pownall Equine Services, and today we're going to talk about flexions of the lower limbs, both the front legs and the hind legs. The reason why we do flexions is to stress the joints. A young horse and a horse that hasn't worked very much in their lives, you'll be able to do flexions and not get any reaction. But as a horse ages or works a lot more in their lives, unfortunately, arthritis and joint pain develops. When we stress the joints, we exacerbate that pain, and it helps us identify in a lame horse which area of the leg may be affected. We're going to do both the front leg and the hind leg. When we're flexing the front leg, you can do a flexion like this, which concentrates on the knee and the elbow. You can do the lower leg, which has the fetlock and the hoof, or you can do all of them together. I'll edit stuff up later. When we do the hind leg, we can do up high, which does the hock, the stifle, sacroiliac joint. With this flexion, it's hard to differentiate between the three. So if you get a positive result, it can mean any one of these joints. If we just want to do the fetlock joint, we let the leg relax and we just hold on to the fetlock. If we want to do the whole leg, do it all together. We'll hold the front leg for about 45 seconds, hind leg anywhere from 60 to 90 seconds. There's a lot more muscle in this area, so sometimes you have to hold it longer to get a result. So here I am flexing the front leg. I'm doing the whole leg. What we tend to do is to flex the whole leg. If the flexion is positive, then we'll separate between the upper part of the leg and the lower part of the leg. Are you ready? Okay. So now I'm flexing the whole of the hind leg. I'll hold this for a horse this size for about 60 seconds. Again, if I see a positive flexion, I will separate the flexions afterwards to do an upper limb flexion and a lower limb flexion. Okay. So that's our summary of the flexion exam. It's definitely a helpful tool in the lameness examination. It doesn't give us an absolute answer all the time, but it definitely helps fits in all the pieces of the puzzle. According to a physical exam, though, we need to have a lot more information, the history, feeling of the legs, seeing the horse in motion, but definitely any lameness exam is not complete without doing flexions.